Morning. We're going to pick up where we left off when Obamacare was passed and after it was reviewed by the Supreme Court. We'll also backtrack a little bit to discuss the simultaneous type of care which had been around for a few years. I'll call this Bush care. This was something unexpected that President Bush proposed and got into practice. And this was something that looked very good when it was brought in. This was Part D Medicare. And this was a situation in which the government would pay for a type of simple insurance for seniors that had medication to buy. If the medication was minimal, the cost of having this insurance made it impractical to do so. But if one had a fair amount of medication, it could literally be a lifesaver. So this was accepted very nicely, called Part D, and this was farmed out to a multitude of insurance companies and left to the insurance companies to manage. There were certain interesting features of Bush care, however, and that is that the government could not negotiate with the insurance companies and the drug companies for the amount that they would be paid. Now, we have an institution called the Veterans Administration. This negotiates with the drug companies, gets major savings, and of course that's only for the veterans. It doesn't negotiate for the rest of us. The situation is different in Canada. The Canadian government negotiates for itself, but it negotiates for all of Canada. And as anybody who has gotten medication from Canada knows, it's perhaps half as expensive. So we have an interesting situation where American drug companies, who I feel are the best in the world, spend a lot of money, and our Food and Drug Administration supervises it, and we end up with excellent drugs, which we basically pay retail on, while other countries like Canada, who have not spent any supervising effort at all, pay approximately half. And that is not necessary. We certainly could be negotiating directly. So one way that this Bush care could be changed is if we had the opportunity to negotiate with the insurance companies and with the drug companies and get that cheap. So this is something that is on complicating the whole cost and outlook, and can be changed simultaneously regardless of what we do with Obamacare. Now, as far as Obamacare goes, there's a huge amount of conflict, and we'll have problems no matter what we try to do. If the states continue their opposition, particularly, of course, the Republican-run states, then there'll be chaos in terms of getting everybody covered. There'll be a huge amount of confusion, a tremendous amount of inefficiency, problems in getting individuals to cooperate with this, and this is not a good prospect. So the people who want everybody covered have an interesting dilemma. Should they push along with Obamacare, or perhaps being very radical. Should they just give up on the process and go for single payer right at this point? Or it's a matter that some people think, some sort of on the left may think, well, let Obamacare go down the tubes and then we'll go for care for all. And then on the rightist point of view, it's, well, let's just stop Obamacare and let's just make sure that there's no single payer replacing it. If you look at single payer, Medicare for all, this looks horrendously expensive. I don't particularly personally care for Medicare. The road to hell is paved with good intentions, and there are so many things that the federal government does with a good purpose that really mess up the works, that interfere with what physicians and hospitals are trying to do, and bog them down with such a huge amount of paperwork that we don't have time to actually take care of our patients. Indirectly, we have tens of thousands of people dying every year because doctors do not have the time to actually spend with their patients. We have alienation, where doctors must spend time talking into their computer, not even facing the patients. And the patients do not react well to this. You have a situation in which they listen, but they feel alienated, and the doctor-patient bond, which motivates the patient to comply, to do the right thing, is broken. And there are many complications of something that's run by somebody else that would take a month to go into. So Medicare for all is not necessarily the best way as far as results. It's a lot less expensive than it looks. What happens is, if you had that, you get rid of the payments that are paid at employers. You get rid of the tax deductions that the government cannot handle. You get rid of the huge inefficiencies of putting this through the insurance companies. And you also get rid of the competitive disadvantage that American firms have because of the extra costs of producing an automobile, say, compared to producing an automobile in other countries. The most important thing is you get rid of the insecurity, you get rid of people staying in particular jobs because of the coverage, and you get rid of a lot of wasted administrative time. It's a dilemma. I don't have an answer, and I don't know of anybody else who has an answer. But the one thing that would really help is if the Republicans and the Democrats grow up and cooperate for the good of the country and forget their playground squabbles. This is not the time. They both need to grow up. See you next time.